Hi there, my name's Samuel M. I'm one of the gastro-regios at St Thomas's Hospital, and I'm here to present my poster entitled Out of Hours Dedicated Transnasal Endoscopy Service, a model for endoscopy recovery during the COVID pandemic. Now, the COVID pandemic has severely curtailed endoscopy services, and there's a resultant delay in diagnosis and of surveillance programs for which a novel solution needs to be found to tackle the resultant backlog of cases. Now, transnasal endoscopy, or TNE, is an attractive option for this for a number of reasons. It has comparable visual resolution to conventional OGD, as well as having excellent patient tolerability. There's a cost saving for the lack of intravenous sedation, and there's reduced nursing assistance during and after the procedure. It also has the flexibility to perform endoscopy in otherwise underutilized clinical spaces and improve the footprint of the endoscopy department by making it larger. And what we did was a pilot study starting October 2019 until March 2020. It was a once weekly evening list scheduled from 4 to 7 p.m. And operated within a pre-existent staff job plans and utilised an unused clinical space within the endoscopy department, which was actually a bowel preparation room, and therefore not impacting on other endoscopy activity. All patients who were referred from OGD were screened and offered unsedated T&E within the inclusion and exclusion criteria, which basically ruled out sort of complicated patients, long bouts of segments, and other things like that. But you can take a look and review this in your own time. The full rollout subsequently occurred in September 2020, comprising 3 6-patient lists per week, covered by 9 endoscopists who had all attended formal T&E training. Patients were prepped with 50 ml of a mucolytic drink to enhance the mucosal visualization, and were also given a nasal spray of 5% lidocaine and 0.5% phenylephrine. They were also given lidocaine throat spray immediately before starting the procedure. We used Fujifilm 7000 series scopes for the pilot, and also added in Olympus XP290N scopes for the full rollout, alongside pediatric biopsy forceps. In total, we had 225 patients underwent TNE, 98 in the pre-COVID-19 pandemic pilot, and 127 in the rollout. Overall, the TNE completion rate was 93%, which was an 100% retroflexion rate, 98.2% DG intubation rate, and a 6.2% inlet patch detection rate, which is a surrogate marker of endoscopy quality and is comparable to conventional OGD in terms of the rate of detection in our study. The reasons for incomplete procedures were difficult nasal intubation, patient intolerance, and one patient had food in their stomach, so we weren't able to complete the procedure. The procedure length was 8.7 minutes in the pilot and 9.9 minutes overall, and the longest procedures being those converted subsequently to an oral route after a failed nasal intubation. There was good patient tolerability, with 94% of patients from the pilot and 92.6% from the full rollout experiencing no or minimal discomfort from TNE, with 91% who had experienced of both routes preferring TNE over conventional OGD, albeit small numbers. Overall, TNE was also safe, with only 2 cases of mild epistaxis, which was self-limiting, resulting in an overall complication rate of less than 1%. We had 448 biopsy samples taken from 95 procedures, and the average size of the largest biopsy was 4.27 millimeters cubed, and all sets of biopsies were sufficient diagnostic quality, including those for the diagnosis or assessment of eosinophilic esophagitis and for Barrett's esophagus. So the conclusions from this, lots of benefits from a TNE service. It's safe, it's a high quality option for upper GI endoscopy, has excellent patient acceptance, it uses less resources such as time, both for the patient and for the endoscopy team, less sedation and less personnel, and it also maximizes underutilized spaces within the hospital, and then overall provides a convenient and comfortable alternative for patients to conventional OGD. So that's the end of my presentation. If you've got any questions, I'm more than happy to answer them. And you can obviously have a better look at the poster itself if you want to now. Thank you.